Hello, this is a shorter version on my video on community treatment orders under the Mental Health Act 2007. If a patient is on a Section 3, Section 37 hospital direction or transfer direction, no longer requires treatment in hospital and can have this in the community, the responsible clinician, with the agreement of the approved mental health practitioner, may discharge the patient under supervised community treatment. The patient must suffer from a mental disorder of a nature or degree that requires treatment for their disorder, and that it is necessary for their health, safety or safety of others that he or she should receive treatment. The patient needs to be liable to be recalled to hospital by the responsible clinician, and treatment in the community needs to be available for the patient. The responsible clinician and the approved mental health professional need to put it in writing that they agree for the CTO to go ahead. There are two mandatory conditions for the community treatment order. The first is that the patient makes himself available to be seen by the responsible clinician for the purposes of extending the community treatment order. And the second is that the patient makes himself available to be seen by a second opinion appointed doctor for the purpose of reviewing their medication treatment plan and consent to treatment for this. The community treatment order initially lasts for 6 months and can be renewed for a further 6 months and then annually thereafter. Before it is time for renewal or otherwise of the community treatment order, the patient needs to be seen by the responsible clinician, and the responsible clinician and approved mental health professional need to both agree that continuation of the community treatment order is appropriate for the patient and that the criteria for the CTO are still being met. At any time, the responsible clinician can take the patient off the CTO. The patient may be recalled to hospital for a period of up to 72 hours if they break either of the mandatory conditions of the CTO. The patient may also be recalled to hospital by the responsible clinician if, in his or her opinion, the patient requires their medical treatment in hospital and that there is a risk to their health, safety or safety of others if the patient is not given treatment for their mental disorder in hospital. Breach of a non-mandatory condition will be taken into account when considering the criteria for recall to hospital. During the 72-hour period that the patient is recalled to hospital, the responsible clinician may revoke the community treatment order and the patient would remain in hospital under a Section 3. The admission criteria for a Section 3 must be met, and the approved mental health professional will need to agree that the criteria are met and that revocation of the CTO is appropriate for the patient. The patient or nearest relative can appeal against the CTO of the patient in the following ways. The patient may at any time request that the managers of the hospital responsible for the patient's treatment, that is the hospital that they were discharged from, take them off the CTO. The patient may also apply to a mental health tribunal each time he is put on a CTO or the CTO is extended. So within the first 6 months of being on a CTO, then within months 6 to 12, and then annually thereafter. The nearest relative may also appeal to the hospital managers to take the patient off a CTO. This will happen if within 72 hours the responsible clinician does not write a report to state that the patient needs to remain on the CTO for their own health, safety or safety of others. If the responsible clinician does write this, then the nearest relative will, within 28 days, be able to apply to the Mental Health Review Tribunal to consider discharging the patient from their section. I hope this has been useful. Thank you for listening. Bye for now.